So this is the Sit to Stand, the Sarah 3000. I'm just going to talk to you about this machine and then we'll do the Sarah Lift. They have very similar looking slings. They're disposable, so they are not to be used in between patients, but can be used in contact rooms if you wipe down the machine with the dispatch wipes afterwards. You'll notice there's cushions on the top that help you to remember it goes underneath the arms of the patient. So you're going to slip it down behind them and Velcro this piece here. The machine itself can widen to go around any chair and higher and lower to be at a height that can hook into the hooks. You want to use the smallest hook you can, there's two, to make it nice and tight around the patient. One thing about the Sit to Stand is the patient can't walk. It just helps the patient to stand up. You're going to buckle the seatbelt buckles around the legs of the patient on each side. And once you have the knees on the knee blocks, you're going to lock the lift in place. You hook these clips onto the metal parts and the patient should hold on to the handles. You're going to raise it up either with the stick or the buttons here to bring the patient up to a standing position. You should encourage the patient to stand as much as they can and pull through their arms as much as they can to help. If the patient can't come all the way up to a stand, you could stop here, manage their pants, clean them, whatever you need them to do, or you can continue on into a full standing position. Once the patient's in a standing position, you can unlock the lift and wheel them to a different chair, maybe through a bathroom door, sit them down on a commode, sit them down at the edge of the bed, or whatever your transfer destination is. The downside to this machine really is that it's difficult to get the patient to the edge of the bed. So sometimes the patient will need to be, this might be useful with a patient that you hover mat to the chair and then just need to check and change and want them to remain in the chair. But really it's designed to use from a chair position, not necessarily from edge of bed due to poor trunk control.